What self-diagnosis did you give yourself that turned out to be completely wrong? I thought I had worms when I pooped, so I fished one out from my poo and put it in a little box and showed the doctor. Turns out it was a noodle. Feeling real glad I'm not a doctor right now. I once thought I just strained a muscle a bit. A month later I realized it was testicular torsion, and for some reason I felt the pain above my parts. I had just moved to a different country and had to do a 14-day quarantine. By the 8th day I started having stroke-like symptoms, having trouble breathing, heart palpitations, body going numb, not being able to speak properly. I was sure I was going to die and that it was definitely a stroke or a heart attack. I got taken to the hospital only to be diagnosed with panic anxiety disorder. It didn't make sense to me at the time, but now it does. To be fair, I've had hundreds of panic attacks and they always feel like a heart attack. If I didn't have great health, I definitely would have been more worried. My aunt and I both got really sick, like throwing up for almost 2 weeks. Decided we had gotten food poisoning from some bad ceviche at a family gathering. Nope, we were both pregnant, had babies 3 weeks apart. I can hear you and your aunt telling people that you don't eat at ceviche at family gatherings anymore. Not after last time. When people ask about food poisoning, you're replying how last time it caused pregnancy. I'm 4th grade. I felt lumps under my nipples which led me to believe I had breast cancer. One night I came out to my parents and broke them the news. Turns out it was just boobs. I diagnosed myself with a brain tumor due to headaches. Was so convinced that I got a CT scan and turned out there was nothing wrong. Anxiety is a bee and will help convince you of anything negative. I suffered constant headaches at one point. Turned out I was very dehydrated as I don't often drink. I had hypochondria as a teen. The most horrifying by far was when I gave myself an AIDS diagnosis and kept it all to myself. Only now, many years later, have I been able to share this with my closest friends. I was sure I wasn't going to see my 18th birthday. There was no way possible I could have had it and I didn't have any symptoms. This internal panic lasted for about 2 months and became to a halt because I realized how ridiculous it was. With that stopped also my hypochondriatic thoughts once and for all. I know some people aren't that lucky and can't shut it down with just the power of logic. That's why hypochondria is no joke. That crap eats you up inside. I had the opposite, where everyone told me I was a hypochondriac and not really sick. Turns out I was extremely ill and delayed treatment for decades because of it. My tongue looked weird and I googled it. I thought I had thrush, so I put gentian violet on my tongue, turning it blue. I went to the doctor later with my blue butt tongue and she was like, "This isn't thrush. Stop using the internet instead of coming to me." I misread this and thought you went to your doctor because your tongue was blue. When I was 11, I convinced myself I was bleeding to death. I thought I was peeing or pooping buckets of blood, and that's definitely not good. Right before I went to say goodbye to my family, I remembered that thing they told us about in sex ed like 6 months ago. It was a period. I got my period. Ovarian cysts. Had quite some pain. Pregnancy test was negative and had no other explanation for the pain in the area it was in. Turned out I was in fact pregnant and had a nasty case of nesting pain. The pregnancy test was a false negative. I was very relieved to be wrong. The pregnancy was planned. Ovarian cysts were not. I was about 10 weeks pregnant with severe pain that had me doubled over. I thought it was an ectopic pregnancy. It was a ruptured ovarian cyst. Baby turns 3 years old tomorrow. I thought I had food poisoning for a month. Eliminated everything possible from my diet and started probiotics to reset my digestion. Nothing helped. Turns out it was a late life pregnancy. We'd thought we were past that point. Surprise. My dad's old next door neighbor thought that you couldn't get pregnant after 40. Like, that somehow on your 40th birthday, a switch flipped and voila, no more chance of babies. She found out how wrong she was when she conceived at 41. Probably because she told her boyfriend they didn't need protection anymore. I spent years feeling exhausted and like I had to throw up, especially after going out for dinner. I figured I was lazy and had a delicate digestive system that was prone to food poisoning. Nope. It was celiac disease, and the only time I ate bread that made the symptoms really obvious was when I ate at restaurants. Last year I got pregnant. For the first time, I was shocked that no one mentioned how painful it is. Like I had these ongoing sharp pains in my stomach. I don't usually like taking painkillers, but I was taking so many a colleague even noticed and told me I should slow down on them. You know, pregnancy isn't that painful, unless it's ectopic. Thankfully had the surgery before it ruptured, and a month before the world shut down. Oh geez, hope you are doing okay and sorry for your loss. I was having frequent episodes where my vision would blur, my tongue felt swollen, my speech would get slurred, my concentration would drop to null, I would stagger, I would have goosebumps. These symptoms would come all at once and would last for hours. Once they were gone, I felt exhausted. I thought for sure that it was something neurological. Lots of testing later, turns out it was a conversion disorder. The symptoms were an adverse reaction to stress and anxiety. Treatment is helping, drugs, therapy, etc. The episodes are a lot less frequent now, and also less severe, but I was forced to retire because of this. I didn't like that part. Still having trouble adjusting to that part. Slightly unfit, actually asthma, feeling down, nervous, panic attacks, lose all motivation, angry that I don't want to do anything. Thought it was just a bit of stress. Actually really bad anxiety causing depression. I had the reverse. Parents were convinced I was asthmatic. Nope, just a fat kid. My lower back usually aches for the first minute of the day whenever I would wake up for the last 2 years. I'm 23 years old and I worked at a warehouse for a summer. I chalked it up to just morning aches and pains. It never really bothered me because I never had any pain that lasted for more than 5 minutes in my lower back, so I didn't think much of it. One morning I woke up and I just cried because it hurt so much to move. I was constantly taking Robex, and when the pain started traveling down my right leg I would take Advil depending on what hurt the most at the time. I ended up going to a chiropractor down the street from my home, and she thought I had a herniated disc and sciatica issues, so I didn't think much of it. Eventually it got to the point where I needed gabapentin prescriptions to help numb my nerves. 2 months passed and it was progressing and getting worse. So she sent me for an x-ray referral, both of us thinking nothing would show up because it was clearly just nerve pain and a herniated disc that would heal over time. Wrong. Boy, we were both so wrong. When I went in for my appointment, she sat me down and started off with, "So you're not going to believe this," and then proceeded to tell me the x-ray results. I have moderate scoliosis, degenerative disc disease, bone spurs between my L1 L5, and I have spinal stenosis. I had an MRI back in October fatefully in my abdomen, appendicitis scare, which showed the part of my spine that would cause me pain in the near future, and the doctor who checked my X-rays used that scan as a cross-reference just because they were curious and saw it on my file, which led to the stenosis discovery. So now I am currently waiting for another MRI referral to focus solely on those spots to determine how bad everything is, and I have a spinal surgeon referral as well. I'd also like to add I am in Canada and my family doctor took me off of his list right before the pandemic, November-December 2019, and I have been unable to get one since, which is why my chiropractor did the x-ray referral and went over the results with me. I've been calling clinics non-stop. I'm on the government list. It's heck for me right now trying to find a doctor while dealing with this sudden bombshell. The waiting time for the MRI is between 4-8 months where I live. I knew it was scoliosis from just the first sentence. It's the upper part of my back that hurts every morning though. What I thought was a pulled muscle in my shoulder actually turned out to be a torn labrum and minor inferior shoulder dislocation. I thought my hip just needed to pop. For months, until I could no longer walk. Torn labrum for me, too. Swelling in my ankles, that was obviously a case of tendinitis. Nope. Congestive heart failure. 1 heart operation and 2 stents later the swelling is gone. CFS Me. I had many of the symptoms and was consistently refused medical help because I was told that I was making it all up, as the blood test showed that there was nothing wrong with me. Also a hallmark of CFS Me. It turns out that I have an autoimmune issue that's treatable. Welp, that's 6 years of my life that I'm not getting back. Not having stuff show up on blood tests when you know you're sick is the worst. Doctors start treating you like a hypochondriac and your treatment gets delayed. I thought I had a hearing deficit because I always miss what people say and have to ask them to repeat. Turns out I'm just ADHD and can't focus on things that are not interesting. Ha, I'm pretty much the opposite. I thought I had auditory processing disorder or ADHD, but it turns out I have moderate hearing loss. Stomach cancer. One day a huge amount of blood in my stool and was convinced I was going to die. Google confirmed my prognosis. Forgot about the large amount of beets eaten the prior day. Next day all the blood was gone and I'm now back on the road to recovery. You beat cancer. I was nauseous and vomiting all the time at work and home and just about everywhere else. I thought I was in liver failure. The first 2 doctors I saw dismissed me, said it was the flu. Can the flu last 6 months, freaking idiots. The 3rd doctor I went to was skeptical but I demanded a full blood panel. Turns out I was wrong. It wasn't liver failure, it was kidney failure. The doctor was stunned and extremely apologetic. I totally needed a kidney transplant and it saved my life. That I hurt my spine rather drastically in a fall on black ice. Within a few days of the fall, every time I looked at my feet I got an electric shock from my neck to my feet. And then my legs were going numb. Like crap, man. I fricked my back up. Nope. Completely wrong. Turns out I have multiple sclerosis. I had a migraine for 6 weeks straight. My mom was sending me articles to convince me I had some sort of brain leakage. It turns out the migraine was caused by my birth control. I had something similar. It took me a week to figure out it was the antibiotic I was taking. Like clockwork, 20 minutes after each dose the migraine got worse. I thought I might have scarlet fever last year. Turns out, Still's disease. My body turned on itself. No exotic infection necessary. My doctors, are you sure you haven't been overseas in the last few weeks? I had scarlet fever in 2019, lol. It was pretty serious, there were red spots everywhere, and severe muscle cramps that made me unable to walk. And later that year I got diagnosed with severe polyarteritis nodosa and severe hypertension. Blood pressure was 170/200. You're lucky you didn't have scarlet fever. I get extremely itchy on my belly and groin area. I always think it's because I did a bad job rinsing soap off after taking a bath. It's because of the oral steroids I take for my allergies. This has happened 4 times in the last 5 years, and I forget every dang time. I thought I was tired all the time because I didn't eat healthy and was chubby, didn't exercise. I took naps and began to more frequently lose focus at work. I took a blood test because our country said they were desperate for blood donors. Due to COVID, less people were giving. Turns out my iron was 7. Normal range is between 3300. I had iron deficient anemia, it was so low. I got an iron infusion and 5 days later felt incredible. Strep throat when I was 26. Got some Advil. Went back to work, I could only sleep sitting in bed because laying down made me unable to breathe. I looked like crap for 3 days. Co-workers forced me to go home and see a doctor. I had mono. Had to miss work for 2 weeks. If I were your co-workers, I'd be pretty upset you came to work while thinking you had strep. That I was going to need a kidney transplant in the near future. Rewind a year. Admitted to the hospital for an untreated UTI that spread to my kidneys, causing me to go septic. Stayed for about 4 days. While being released, asked the doctor if my kidneys were damaged and he said yes. Too drunk, depressed to go to the specialist the next day. Fast forward a couple months and I had stopped drinking and finally started taking care of my health. The anxiety of what was wrong with my kidneys eventually outweighed my medical anxiety. Went to the doctor yesterday and my kidney and liver numbers are actually near perfect according to my doctor. I was very fortunate it ended up that way. Don't ever assume a UTI will clear up on its own. It won't. I made this exact mistake with a UTI and it became a kidney infection. That and the time I got pneumonia when I didn't have health insurance were 2 of the worst medical issues I've ever had. First time I had unprotected sex. I had convinced myself I had HIV. I had just gotten divorced and hooked up with a girl I knew in high school. We didn't use protection. And a few weeks later I was getting these raised welts on my arms and inner thighs. Google told me one of the things it could be was HIV rash. My doctor, who I've known my whole life, said I was an idiot, did an STD test, and diagnosed me with bug bites. My neighbors had brought bed bugs into our app building, so I'm clean and STD free, but it also taught me not to Google symptoms for my mental health. A nurse once told me that I probably have AIDS because I got pneumonia, bronchitis and then cellulitis all in a row. When I went to a doctor, he told me that nurse was an idiot and I just had some really bad luck. Went to have a suspicious mole checked out. It was just a mole, but the pimple on my cheek was a squamous cell skin cancer. Squamous is one of my favorite words. Sorry about the skin cancer though. I was for sure positive that I had Crohn's disease. Literally almost every symptom applied to me. Nothing, not a thing was found in either my colonoscopy or upper GI endoscopy. Yep, it turns out that I just drink too much. I had the opposite. Thought I was becoming intolerant to alcohol and caffeine. Turns out I have ulcerative colitis. Finally figured that out after I became intolerant to food in general. There's no way my hand is broken. I can still move my fingers and it doesn't hurt too bad. I've just bruised it. Hospital would be a waste of time. Nope. Turns out it was a complete clean fracture of the fifth metacarpal bone. What I thought was just swelling was actually the bone pushing against my skin. I've been to the hospital 3 times in my life, thinking I had a serious life-threatening issue. A lump in my side that was twitching and hurting a lot that I thought was cancer is actually just a lymph node or benign fatty tumor, they said. That was 10 years ago. That lump is still there though. It doesn't hurt anymore. Hasn't for a very long time. I have swelling in my feet and legs, and one day as I was sleeping, I was awoken to an extremely sharp pain in my leg that I've never experienced before. It felt like I was being stabbed with a knife. People with my kind of swelling have a risk of blood clots, and getting a blood clot in your leg can very easily be fatal. Turns out it was just a muscle spasm, and recently, I've been suffering from what I thought were gallbladder attacks for over a year. Every couple of months, there would be a pain in my middle right abdominal area, just under the ribcage. There would be a slight swelling of my stomach, and pain at even the smallest bit of pressure. Each time it happened, the pain would gradually go away, usually after I force myself to vomit or just suffer through it. This time, the pain went away all at once, after my insides did this very odd gurgly bubbly sensation. I then became very bloated, and my guts felt like they were churning and bubbling constantly. I thought my gallbladder had ruptured, which can very easily be fatal. Doctors said they didn't think that was the case, said I was just bloated, which I honestly have never experienced either. I didn't know what being bloated felt like, and sent me home. I turned out fine. No yellowing of skin, no death, no sepsis. So yeah, my gallbladder didn't rupture. I guess I just have gastrointestinal issues now. Yay being 30. Your last one was sort of opposite for me. Woke up with some of the worst pain I'd ever been in. Too high up to be digestive and too low to be cardiac. I thought I had a cracked rib. Turns out it was gallstones. Definitely not fatal like a ruptured gallbladder would be, but I did have to have surgery to take the dang thing out. I was 34. Narcissistic personality disorder. I used to do a lot of maladaptive daydreaming and I misunderstood a comment on the internet that made me think I had NPD. Thankfully I know how to speak the language of the country I was living in at the time, and there was a psych hospital nearby that charged a reasonable amount and had an appointment available not long after that. I wish everyone who complains about self-diagnosis of mental illnesses, especially the ones who be about them non-stop, would call the applicable members of their government about making affordable mental health care available to more people. In January of 2020, me and a bunch of people in my class got sick all of a sudden. I felt like I was dying. My chest hurt, head hurt, fever, lightheaded, and when I fell asleep I couldn't breathe. When I got back everyone was joking, saying that I got that new virus from China, but at the time there was only one case that was a week prior. I had no idea what I actually had, but fast forward 2 months later it turns out it was in fact COVID, and many other schools in my area had similar incidents happen months before there were even people getting tested. A friend of mine got super sick in February. It started with allergies and an on and off fever. Then, ended up in the hospital due to shortness of breath. One of his lungs collapsed and he had pericarditis. It took him months to recover. We're pretty dang sure he had COVID. Fit, until I tried to get through a workout with my buddy who's an NFL player. I felt like a walrus trying to keep up with a gazelle. LOL. Just remember, fitness is a personal goal, not a contest. Unless you're a professional athlete, then it's absolutely a contest. I went to the hospital 3 different times because I thought I was having a heart attack. Turns out they were panic attacks each time. I have meds now to prevent panic attacks. One doctor was annoyed, which I found funny. Dude, I thought I was dying. One of those trips involved a volunteer fire department and an ambulance ride because I was camping far from any hospital. You're not the first for sure. It's crazy how panic takes over logical thought so quick. I'm sure I'll die of a heart attack because I'll dismiss it as anxiety. Every physical illness to do with the digestive system, including but not limited to stomach cancer, ulcers, celiac diseases, etc. Turns out, all of it was just another side effect of anxiety disorders. That despite all other symptoms I absolutely denied having. I have anxiety and the symptoms can manifest as something that feels so physical and real when it's really just the anxiety. That I wasn't psychotic. Religious delusions and thinking a god is going to make you kill yourself is psychosis. It does not matter if you know it's not real, it's just ideas if those ideas are genuinely likely to kill you. Self-diagnosed severe depression that more or less rendered me incapable of normal functioning. Could barely get out of bed in the morning, lacked the desire or energy to do much of anything and felt like even trying to get help was pointless, which I attributed it to the depression itself. Turns out I had a severe vitamin B12 deficiency and the symptoms are scarily similar. The fact that I was a bit depressed, but not more than any stressed out young adult, made me tunnel vision on that and ignore any other causes that may be contributing. Don't neglect your bodies like I did. People, that sinking feeling of despair and hopelessness is not always your brain fricking with you. Sometimes it's your body's way of crying out for help. Went down a rabbit hole of personality disorders once and legitimately believed I had schizoid personality disorder for several months. Nope, just depressed. I thought I had cysts or vaginal cancer because every month or so the lump I could feel when I stuck my fingers and they would get bigger. Went to the doctor and asked for an ultrasound and camera to look inside. Nope, I was just touching my cervix. I thought I got food poisoning from Wendy's. Couldn't eat for weeks and Tums just made it worse. Turns out it was the painkiller I took on an empty stomach and my stomach acid levels were hella low. Lost 30 pounds though. I did not have an ulcer. My mother had suffered from ulcers and I was sure that was what I had. I had gallstones, but the surgeon I was referred to by my nurse practitioner didn't believe that thanks to the ultrasound that showed my gallbladder was slightly enlarged, but not full of stones. They went back and forth with each other and I guess based on my symptomatic presentation, and the fact that the NP was just a badass, God rest her soul, he went ahead and scheduled the surgery. In recovery he informed me that not only did I have many stones but my gallbladder was so infected that if he hadn't operated I would have been in much worse condition, as it was near rupturing. Thank you. Gallbladder sludge. The sludge was apparently the culprit for hiding the gallstones, as on the ultrasound it masked the stones. And it wasn't slightly enlarged, it was very enlarged. The surgery was done laparoscopically, but the scar where the main instrument was is about the size of a golf ball, compared to the other two, which are the size of pencil erasers. They had a very difficult time getting the offending appendage out of the incision, and it still itches me to this day, 7 years after the fact. TLDR, though I had ulcers, turned out I had horrible gallstones and a very infected and swollen gallbladder. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.